like this. So my name is Mike McDermott. I'm with Assimile. So we're really excited to be here today. We love sponsoring talks like this. We believe in collaboration. We believe in education. That's how we think healthcare gets better. And that's a mission of our company. What we do is help secure all your devices, all your network to ensure that your data can transfer between applications, between devices, safely and securely to prevent bad things from happening and bad people from getting in your network. But what's great here is I'm here to introduce our speakers today. Dan Fritzy, did I get it?
Yep.
Thank you, sir. Dr. Bottles, and then Garrett Tedesco to talk about patient experience, and that it's not just clinical. So with that being said, I want to turn it over to Mr. Dan.
Thank you, Mike.
Absolutely.
I'd like to introduce, well, we know Dr. Bottles, and I think the compromise that Jeff made was that instead of a whole day, you get 2 sessions.
Okay.
So, although you have to share this one with Garrett. And our other participant is Garrett Tedesco. You'll see their names, their pictures up here. Feel free to look up their bios, and we'll forsake and pick up time by not going through an individual introduction, so to speak. What we're talking about is, the topic is, and I'll read it out here, it's rather wordy, improvement of the patient experience to improve patient retention and be competitive has now reached into traditional operational areas such as scheduling, access, and revenue. A lot of words to just say what is new to the patient continuum, engagement continuum, non-clinical. We can't say just non-clinical because we know that it's a fully integrated component now that healthcare is for patients. So with that said, I'd like to open up with a general question for both Garrett and Dr. Bottles with, from your perspective, what are the 1 or 2 most impacting changes to improve the patient experience and or engagement as it relates to the patient engagement continuum? So Garrett, if you don't mind going first.
Thanks, Dan. So just real quick, my name is Garrett Tedesco. I'm the director at Cope Health Solutions, and my tenure in healthcare has been surrounded in health plans, IPAs, TPAs, the sales industry, all side of healthcare, but on the provider side. So everything from the full provider life cycle, so that's kind of where my lens sits and hangs out. I'm just going to speak really loudly to the people in the room to get them back over, because the time slot before lunch is horrible, but I get it. So I think, one of the things, I'm also full Italian, so if I sit down, I will implode if I can't talk with my hands, so forgive me, I'll be walking around, because otherwise you'll find me on the floor on fire. So, a lot of what we're concerned about from the provider side of healthcare, and that's strictly where I kind of hung out for my tenure, is really on how can we improve member engagement, predictive modeling, and physician engagement. Now, all of those have individual swim lanes of